After decades of war, the disabled in Cambodia are plentiful. In 1992, while working with the American Red Cross, Dr. James Galogally, also known as Dr. Jim, visited the country for the first time and described the situation as the worst he'd ever seen. Knowing he had to do more, he left America and headed for Cambodia, where he founded the Children's Surgical Center in Phnom Penh. Today, thousands of disabled people from all corners of the country travel to the center seeking treatment. Believing in fairness and equality for all, Jim offers each patient their own treatment plan with surgery at no cost. Up to 20 operations are conducted at CSC for free every day. Thanks to Dr. Jim's work, many of Cambodia's disabled are given the priceless gift of being able to lead independent lives and support their families.
I've seen people who couldn't see, bilaterally blind, being led by a small child around because they couldn't get around, and we don't have seeing eye dogs in Cambodia. And in 20 minutes, somebody's removed their cataract and they've got a patch over their eye, but they can lift the patch up and they can see. Now, I think that's a miracle.
What makes CSC special is its large network of visiting international specialists. Medical staff can train under a range of specialities, and by introducing new programs, Dr. Jim has helped transform and modernize Cambodia's medical system. New and successful procedures at CSC are later picked up by government hospitals and private clinics.
My ultimate goal is to keep this going until the government takes over and makes provision for treating what I call crippled children. I want to leave behind a lot of people who feel a lot better because of the treatment they got from us, and can get on with their lives better.
To date, CSC has conducted free surgeries for over 67,000 poor, disabled Cambodians who are now living better, more fulfilling lives. Is Dr. Jim Galogally the one? A passionate fighter for the underprivileged, Jeff Rottmeyer is dedicated to helping the homeless, autistic, and Down syndrome communities reach their full potential. Hong Kong is home to roughly 2,000 street sleepers. Every day, Jeff organizes kindness walks through his charity Impact Hong Kong, where groups of volunteers hand out food and necessities to the homeless in destitute neighborhoods. The eye-opening experience has created a ripple effect, gathering over 1,000 volunteers to serve 500 of the city's homeless every single week.
The greatest thing that I would want in creating a movement and creating, change for these people is in educating the public. So just in having people understand about what our vision is and how we're finding success in providing them with a different opportunity, with friendship, love, opportunity, connectivity, community at the forefront.
At the guest room, Jeff provides a safe place to eat, rest, and form friendships. The homeless receive counseling, they play ping pong, learn English, and find work and housing assistance. Last year, his holistic approach helped 37 people off the streets and into homes, and 16 are now employed and leading completely independent lives. Perhaps the most important gift Jeff has given them is love and human connection. The Love 21 Foundation, Jeff's second charity, caters to 50 Down syndrome and autistic members from low-income families. Aware of the shorter lifespan for this group, Jeff hopes to add years of happiness and health to their lives and integrate them into society. With a focus on nutrition and fitness, many have shed unhealthy pounds and have found the confidence to embrace their individual talents.
I'm really passionate about fighting for people in need, fighting for people in our community who are judged, fighting for people in our community who are held back. That's one of my greatest passions. I really like giving people an opportunity to reach their full potential.
Leading with his genuine and simple philosophy that kindness matters, Jeff has earned a strong following for both his charities. Is Jeff Rottmeyer the one? In the Indian village of Hansbukor, poverty and disease run rife. Villagers live without any basic amenities. Subhasini Mistry learned this the hard way when her husband passed away at the young age of 35. Devastated and wishing no one would experience the same tragedy, she vowed to one day provide free treatment to all the villagers of Hansbukor. Having only known a life of poverty, Subhasini spent the next 2 decades selling vegetables, cleaning houses, and laying bricks, saving every penny she could. Stretched to her limits, she was forced to send one of her sons to an orphanage. Her hard work eventually paid off. She had gathered enough to purchase a plot of land at Hansbukor, where she founded the Humanitarian Hospital. In many ways, the hospital was a community effort. Some donated money, some supplied building materials, while others volunteered for construction work. Eventually, Subhasini's son, Dr. Ajoy Kumar, would join the hospital as a doctor. His daughter followed as a nurse.
যাদের জন্য হসপিটালটা হয়েছে তারা যেন এখানে এটা যেন ভালোভাবে হয়, তারা যেন এখানে ট্রিটমেন্ট পায়।
Now open for over 23 years, Humanity Hospital serves up to 500 outpatients from Hansbukor village and its surrounding areas every day. Subhasini wakes up at 5 in the morning to supervise patient care, comfort the sick, and solve daily problems. She ensures all who are admitted receive the best treatment, regardless of their caste, creed, or financial status. Now 77 years old, Subhasini's dream isn't over. She hopes to build a second hospital at Sundarbans, which is currently just a thatched hut.
আমি অলৌকিককে বিশ্বাস করি না। আমার ছেলে অলৌকিকে বিশ্বাস করি না। সকলে মিলেমিশে একটা যদি কাজ করি ভালোভাবে হয়, একার দ্বারাই হয় না, একার দ্বারাই সম্ভব হয় না।
Is Subhasini Mistry the one?